This is the story of Werdnig-Hofmann syndrome. It's known as spinal muscular atrophy type 1. It's an autosomal recessive condition caused by the mutations in the SMN1 gene on chromosome 5q. And this gene makes a protein that helps assemble your snRNPs, a tiny little kind of machine that helps you splice out introns from the pre-mRNA. And so if you don't have these splicers, the motor neuron cells can't process mRNA properly and they'll just die, especially the lower motor neurons. And that's why the babies will present as floppy, weak, they'll have tongue fasciculations, and often they can't breathe very well. It is insane to think about the many things that can go wrong with the human body. The backup gene is SMN2, and this helps a little bit, and that's where there's a new drug that comes in. Check it out. So here it is. Zolgensma is your gene therapy that replaces your SMN1. And there's also another medicine, the Spinraza, which increases the SMN2 splicing that boosts the SMN protein production. And so basically, if you have an SM1 mutation, you get the loss of the snRNPs, which is like your spliceosite ability. And then you have lower motor neuron death, and that causes your floppy baby syndrome. And so here's your little practice question that you can settle on. Take a look. Basically, we got to, also it could be seen with, your spinal muscular atrophy is generally seen with congenital degeneration of the anterior horns. That's autosomal recessive SMN1 mutation, encoding for the survival of the motor neuron protein. That's why it's SMN1, motor neuron. And it's defective in snRNP assembly, which leads to lower motor neuron apoptosis. And then you get spinal muscular atrophy type 1 is most common in the Werdnig-Hofmann disease. So floppy baby, there it is. Flaccid paralysis, tongue fasciculations. The answer is not going to be a DNA repair. You'd think of your ATM and your BRCA mutations. Lysosome, that's eye cell disease, so it's not going to be the trafficking. And the protein degradation would be relevant to your ubiquitin proteasome pathways. Okay, next time maybe we'll talk about some other things. I don't know, poliomyelitis or spinal muscular atrophy or AMLS or Tabes-Dorsales or subacute combined degeneration. Who knows? Who knows? There are many things that we could do together. If you like and subscribe.